Good afternoon. I'm Tassos Stathis. I work at the Oncology Institute of Southern Switzerland in Bellinzona, and today I will briefly review some of the highlights of this EHA2026 lymphoid neoplasms, in particular with regards to some studies that may have some consequence in the clinical practice in the future. In this year conference, we have seen the results of studies which they do bring a particular message, which is represented by the efforts to bring non-chemotherapy treatments, in particular immunotherapy, in the earlier lines of therapy. Now, many of the studies that were presented showed preliminary results, for whom we will need to wait some more follow-up. But I think there are already some interesting results. In diffuse large B-cell lymphoma, the most common and aggressive lymphoma subtypes, a randomized study at the plenary session presented the results of the addition of an anti-CD19 antibody, tafasitamab, and lenalidomide to the standard R-CHOP chemotherapy. And the study was positive because the primary endpoint of progression-free survival was met. Now, will this study change the practice of care? I think that this is something that will need some further and important considerations in a disease type where the current therapeutic landscape has enormously increased and improved in the last year. So I think it is questionable if this will change the standard of care. We have seen results also with bispecific antibodies, such as the EPCORE DLBCL trial, which also is an important attempt to bring a bispecific antibody to the earlier lines of therapy in patients with relapsed refractory disease. And similar studies are being performed also in follicular lymphoma, the most frequent of the indolent lymphoma subtypes, where there were presented several trials with bispecific antibodies in earlier lines of relapse in follicular lymphoma and also in the first line. So these studies are ongoing. We will need to wait the results. But again, as mentioned in the introduction, I think they do bring this important message of trying to develop therapies with immunotherapy in the earlier lines of therapy. Then we have seen trials reporting on new agents like BTK degraders in chronic lymphocytic leukemia, and they do also provide important information on what the future could look like with new agents in different lymphoid neoplasms. Further to that, and looking to cellular therapies, which have now an established role with the CAR-Ts in different lymphoma subtypes. In this EHA, there were presented results with new attempts, including also allogenic CAR-Ts, which represent an important achievement, and we'll need to wait a little bit more on the follow-up to understand if these off-the-shelf cellular therapies could even replace the way we are using today cellular therapies. You will have the possibility to learn more about the new data that were presented through the educational works and the summaries that will come out from EHA. But I think this was really a very informative conference. Thank you very much.